Okay, I'll pop back in here and introduce Dr. Erica Pluhar. She is a licensed marriage and family therapist, licensed professional counselor, and certified professional counselor supervisor in Georgia, as well as a registered telehealth provider in Florida. She is certified as a sex therapist and supervisor by the American Association of Sexuality Educators, Counselors, and Therapists, also known as ASECT. In addition to private practice in relationship and sex therapy, Dr. Pluhar has researched and taught in the field of human sexuality for over 20 years. She completed her undergraduate schooling at Cornell University and graduate training at the University of Pennsylvania and Georgia State University. As a therapist, Dr. Pluhar brings genuine warmth, compassion, and humor to her work and helps to create a safe, non judgmental therapeutic environment in which clients can heal, grow, and flourish. She provides individual, relationship, couple, and group therapy, as well as clinical supervision and training for professionals. Dr. Pluhar's clinical work is based in attachment and systems theories and also incorporates the latest cognitive behavioral sex therapy techniques. She has advanced training in emotionally focused therapy, EFT, and uses this approach to help clients change negative emotional patterns in their relationships and deepen their emotional and sexual connections. Dr. Pluhar enjoys working with a variety of relationship and sexual concerns, such as low or absent desire, desire discrepancy, pelvic pain or painful sex, arousal and orgasm difficulties, life changes such as childbirth, loss, or chronic illness that impact sexuality and intimacy, and healing sexual trauma. She works with individuals, couples, and relationship systems with an active, directive approach that is also rooted in a caring, deep understanding of emotional and attachment dynamics. Thank you so much for joining us today, Erica.
Thank you for having me, Amanda and Ariel and everybody at Renew. Amanda, you and I go back, I think, like 15 years. And I was thinking how remarkable the evolution of this kind of collaboration has been as it relates to treating vaginismus and pelvic pain and sexual pain. When I first started here in Atlanta, there was one pelvic floor PT, one, and she didn't even do manual work. And there were, I think, 5 or 6 sex therapists. So gynecologists were still dismissing women and patients who were having pelvic pain with advice like go have a glass of wine. So we were getting a lot of that kind of stuff. And sex therapists were doing a lot of the treatment with vaginismus and pelvic pain with trying to guide through dilator use. So, I mean, we have just come so far in how we collaborate and support clients and patients with vaginismus. So on the sex therapy, mental health side, what we bring to the team is in 4 areas, lots of education, support. Shame is a big part of this, other emotions that can really contribute to the fear tension cycle, like Ariel was saying, partner involvement, and cognitive behavioral approaches. So I'm going to talk a little bit more about each of those areas. So with vaginismus, as well as any sort of sexual or pelvic pain, we take a biopsychosocial approach to evaluation and treatment. And Ariel spoke to this in a number of ways in her portion of the talk. So medical, physical, we, are looking at having the underlying medical condition or pelvic floor physical therapy addressed. And then our part comes in these other 4 areas: interpersonal, intrapersonal, which means an individual's own psychology, sexual attitudes and values, and sexual behaviors. So we know that, for example, intrapersonally, individuals with vaginismus are often having thought patterns that are catastrophizing, that have a lot of like negativity and fear and rigidity. And so we are going to do a lot of work in that area, what's going on with vaginismus. And so that can help reduce some of the tension and pressure. On the interpersonal side, anytime that there's a partner involved, there can be dynamics around that develop. And so if sex isn't happening the way that folks are wanting it to happen or thinking that it quote unquote should happen, lots of emotions can attach to that. So a partner might feel, or the client might feel, like Ariel was saying, broken, or like something's wrong with me. I'm never going to have the type of sex that I think I want to have or I'm supposed to have, disappointment, chronic frustration. And on the partner side, there might be all of that, and as well as some rejection. So we will try to get the partner involved if it's appropriate. Like there are some examples or some cases where we would just start with the person with vaginismus and then move to bringing a partner in if there's a partner. But oftentimes we'll start right out the gate with bringing the relationship into the office and assessing what's going on in the context of the relationship as it relates to vaginismus and pain. And then we'll do an individual session with each of the people and then bring them back together for some feedback and treatment planning. And we're often having to do a lot of re-education around like the nature of sex. People learn to be very goal-oriented about sex and performance-oriented. I'm going to say a little bit more about that on the next slide, but we do a lot of work to kind of relearn and get some new patterns going that are broader and more experiential and more accepting and more pleasure-based instead of performance. We would also help relationship disrupt negative patterns or dynamics around conflict with sex that might be exacerbating pain experiences or fear experiences. So if one partner is pressuring the person with vaginismus, we would do some work with that around education and how to create support instead of pressure. And let's see, on the sexual attitude side, a lot of times we've talked about shame is a big feature here. So I'm broken, something's wrong with me, I don't fit in, my body isn't working the way I want it to work. And this can come from a variety of sources. I mean, we unfortunately still live in a society where sexual shame is just rampant. And particularly, we could see, different versions of that with religious shame. We could see lots of just pressure and objectification, people feeling bad about their sexual selves, guilt. So we've got a lot to do in that arena in terms of education and de-shaming to help support vaginismus treatment. And then on the sexual behavior side, first and foremost, we want to get people to stop doing things that are exacerbating pain. So we would do a thorough assessment of what behaviors are going on and do some interventions to like stop that fear, tension, pain cycle and work with the pelvic floor PT to make some progress there and then help the individual and or the relationship build a new cycle that's more about pleasure and consent and collaboration. And so we've got lots to do in that area. There are some old sex therapy tools and some new sex therapy tools that we'll give people to use for homework. And I can say some more about that too. So you can see it all works together to help support vaginismus treatment. This is a good example of cognitive behavioral work, particularly more cognitive, that we would call cognitive restructuring. This idea that people come in thinking that sex is a performance and that there's one right way to do it. And if you don't do it this particular way, then somehow you've failed. And so you can imagine that a person with vaginismus who's already experiencing a lot of those feelings, it's just going to be exaggerated all the more of like the pressure to perform. I was talking to one of my awesome sex therapists on our team yesterday about a client that she's working with. And she was like, well, how are you talking to your vagina? What are you saying to your vagina when you have that clenching? And the client was saying things like, come on, why are you doing this? And what, can't we just work the way you're supposed to work, and that kind of pressure, performance shaming language. And so they did this beautiful work around like, how else could you, like, what kind of positive things could you be saying that would take some of the pressure off and be encouraging and that self-compassion. So yeah, sexual performance mindset it can really undermine progress and collaboration. So we help people look at what would be more of a pleasure mindset. So instead of failing and succeeding, we're going to be curious. We're going to be flexible. Instead of either or, we're going to look at things from a both and perspective. Like kind of two things can exist at once. This can be painful and not possible right now, and we could explore some other ways of touching in the meantime. So things like that. How can you discuss vaginismus with your partner? So first of all, back to self-compassion. If you're having a hard time offering yourself understanding and nurturing and empathy, it's going to be hard to translate that into a partnered dynamic. So we really want to work with the individual around some of those pieces that are so foundational to have a positive relationship with your body and with the progress and the process that you're in. And that's going to, translate over and will help the couple, if it's a couple, go from that platform that's back from that, shifting from that performance-driven pressure, demand, rejection, disappointment, to how can we both be in a place of compassion around this? How can we both be accepting and mindfully aware of this is where we are and this is what we're moving toward? Basic communication skills. So things like I statements and reflective listening and how to stay out of defensiveness, being able to recognize when your nervous system goes into threat, not only is your pelvic floor reacting, but your emotions are triggering, and the way you're expressing your emotions can like work against what you're trying to accomplish in the communication dynamic. So we really help partners learn how to slow down, learn how to communicate more vulnerably, learn how to recognize their own triggering points so that they can shift back into more of a safety dynamic emotionally with one another. Lots of resource sharing and education. We really want to, again, bring in partners and engage them in the process. That's something that y'all can do too as PTs. You often will invite a partner in if it's that's going to be supportive to the process. And that way the partner can see and learn what happens with the pelvic floor, maybe learn a little bit about dilators. So we would encourage from the get-go usually to bring the partner in. The other thing that does is it helps the person with vaginismus usually is feeling like it's their fault and they're the one that's not working the way things are not working the way they're supposed to be working. And so to make it a shared process can help immensely in moving person with vaginismus through the process. Seeking help when you get stuck. So we can be a safe space where, say there's a point in the pelvic floor treatment that it's just hard to move, like you've hit a plateau, it's kind of hard to move through that. Knowing that you have that consistent place to come for therapy as partners can really help, like provide that encouragement and hold the hope when things do get discouraging, or when partners get caught in an argument about something, an old conflict comes up. We can help them move through that more easily. We also love to collaborate with the pelvic floor PT world. And so we are, on the phone with releases, of course, and consent. We're on the phone and coordinating care and, checking things out and making sure we're in sync with where people are. This is another example of a tool that we'll use in sex therapy that's in the cognitive behavioral realm. So with primary vaginismus, sometimes we'll see relationships present with a lot of different ways of touching. So if insertion and penetrative sex is not an option because of vaginismus, the relationship can collaboratively develop a whole other menu of ways to touch. That's not always the case though. And more often than not, what I see when folks come in for sex therapy when there's pain or vaginismus is that a lot of touch has become eroded because there's this fear of, well, if we hold hands or if we cuddle or if we kiss or whatever, it's going to lead to the next thing, which will lead to the painful experience or the frustrating experience. So we have a lot of work to do to build touch back into the relationship in a way that is in line with the pleasure mindset instead of the performance mindset. So we help folks break their touch up into 3 different categories: affectionate touch, sensual or non-demand touch, and then genital or erotic touch. So as somebody's beginning vaginismus treatment, we might recommend, of course, that we don't want to contribute to the pain cycle continuing. So we might recommend a pause on any behaviors that seem like they're going to push on that fear response, and back way up to rebuilding, onboarding other types of touch that are less threatening, that are more safe. And those might be in the affectionate touch category, for example. So not uncommon for me to make a recommendation of, like, while you're working on the pelvic floor piece, we're going to pause any sort of genital erotic touch and have the couple fill out this menu, like what kind of touch is available right now, and do those, like really focus on those kinds of touch so that we can get safety and pleasure going on in the nervous system and in the relationship a lot more readily. Sensate focus, I mentioned it here and in another slide, that's a classic sex therapy technique where, again, the emphasis is not on arousal, it's not on orgasm or any sort of insertion or penetration. And people are just practicing giving and receiving touch and giving feedback about it. So as you're advancing in broadening the type of touch that's on the menu, that might be something that sex therapists recommend as well. And there's all ways to customize that and make it, uniquely effective for a particular relationship. There's a lot of great resources out there now for vaginismus and pelvic and sexual pain. Again, this was not a thing back when I started, so it's so awesome to have all of these different resources. These are some of my favorite books. Many of you have probably heard of Come As You Are by Emily Nagoski and Come Together, and those are more general sexuality books, but I think some of what we do when we treat vaginismus is like bring general sexuality education back into the process. And so relearning, unlearning, and relearning is a big piece of it. So those kind of general books can be helpful as well as specific resources about healing painful sex. There are a number of great pelvic floor PT Instagrams. Erica Smith is a sexuality educator who specifically focuses on religious shame and sexuality. Rachel Rubin is a urologist who focuses on all things sexual health. Our Vaginismus on Reddit is an incredible resource. And these are some new things that I learned recently I sit on the advisory board of Pelva, which is a really cool emerging company that's developing a medical device for helping reduce pelvic pain with penetration and insertion through lubrication as well as distribution of force. And one of the founders told me about this Tight-Lipped organization, which it's a podcast and a not-for-profit organization that's devoted specifically to sexual pain and pelvic pain. And she also told me about Tightly Wound, which is a 10-minute animated short film about one woman's journey with vaginismus. I love it. It's fantastic. I would give it to clients in a heartbeat. And I haven't seen the feature film Lady Parts yet, but it looks fantastic based on the trailer. So those are some great new resources out there. Ariel, would you add any comments about your favorites?
I love all of those there. There's actually some of those documentaries I need to check out. I've heard really good things about them too. But yeah, everything there I would definitely agree with. I love all of that. Oh, with the tools, yeah. So tools down here. So Intimate Rose, that is a brand that we carry here for dilators, wands. That is a very reputable brand created by pelvic floor PTs. And also the O-Nut. So I don't have that here with me, but it is a buffer. So that is something that you could either place on a dilator or on a partner. And what that does is just like buffer rings. You would add them, it usually comes with 4, and it would prevent deeper penetration. There's just tools like that we would go over using. Kindra is a really wonderful brand we've also been working with for certain vaginal moisturizers and serums, especially if people are having, for example, if there's hormonal changes causing vaginal dryness. This could be related to oral contraception, nursing, perimenopause, menopause. There has been really good kind of reviews of this, and I personally I love that brand as well. Slippery Stuff, like I mentioned before, that is what we use in the clinic. That is one of my top recommendations for water-based lubricant. I also have other recommendations for water-based lubricants such as Good Clean Love, or when working with a partner and not using silicone tools, there are silicone lubricants that are a little bit more longer lasting than the water-based lubricants. So I personally love like Uber Lube for that. But yeah, so those are definitely some of the top recommendations I'd agree with as well.
Great.